It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
All right, our first guest is Christina Lee, a physical therapist and pelvic health specialist from IRG Physical and Hand Therapy's Evergreen location, Bladder Health today. Shannon, what kind of stuff are we talking about?
It's a big topic. A lot of incontinence, prolapsed, bladder problems. I mean, a lot of men and women have bladder problems, and people don't realize that Christina Lee, physical therapist, is a women's and men's health specialist in bladder health.
All right, let's find out what she has to say with Shannon O'Kelly.
Christina Lee, welcome. How are you doing today?
Thank you so much for having me on, and very well. Thank you.
Well, Christina, you're an IRG physical therapist. You work for IRG, but you work in this field of pelvic health. And I don't think a lot of listeners understand, or they may say, hold it, hang on, what is a physical therapist doing in pelvic health? So maybe you could answer that question. What is a physical therapist doing in pelvic health?
So in pelvic health, for both men and women, we address bladder, bowel, reproductive system concerns. We address pre- and postpartum, or before and after baby concerns, and having good function in all of those areas. So that might mean for bladder, for example, I'm keeping everything in when I want to keep it in, and I'm able to empty my bladder when I want to empty my bladder.
Well, as a physical therapist, tell us how you got interested in pelvic health, because, again, I don't think the general public really understands some of the diversity in physical therapy, particularly folks like yourself that are dealing with how can a therapist help in pelvic health?
Well, I kind of fell into this area. I did all my training for a hospital, in truth. I really first learned about this when I took a trip to Germany to meet the family with my grandmother. And I just always knew that she kind of had to go to the bathroom a lot, but I never really understood how much that it impacted her life until we went to another country. And you cannot just pop into a McDonald's and go to the bathroom in another country. You have to, you got a bit sullen. You got to pay every time that you want to go. And it really made an impact on her life. And I had not really understood that before. But you take someone out of their familiar environment and their familiar, their familiar routine, and then suddenly, oh my gosh, she was just thinking about it all the time and felt the urge to go all the time. So this course, this continuing education program came up at the hospital because so many people were needing treatment for this issue, and I kind of fell into it, and then boom, 20 years later, here we are.
And we're glad you're here because you serve a population of patients, as you were just talking about, that it is from an environmental standpoint, from a quality of living, when you are incontinent or your bladder, or you can't control your bladder, it affects your daily life. But then let's talk anatomical here, and from a physical therapist standpoint, because most people see physical therapy as dealing with muscle, tendons, joints, ligaments, range of motion, strength, things like that. How does a physical therapist affect bladder health, particularly if we're talking incontinence?
A couple of things. First of all, with bladder health, some of it is just our daily routine and our habits. I always say that for a healthy bladder, two things. First, regular fluid intake through the day, and second, regular fluid output through the day. Your body is always looking for homeostasis and balance. So as much as we can help our bladder have regular fluid intake and regular fluid output, that also can help our control. Muscularly, one of the things that therapy can help you with in regards to urinary control is your pelvic floor musculature. So these are muscles that I'm always talking about musculature that you can't actually see. So it's not like your bicep where you can see it flex and then see it relax. These muscles are on the inside. So you know that you are using these muscles if you pull up and in like there's no way that I could pass gas or pee. That's really using your muscles on the inside. but you can't really see a lot on the outside.
All right, you've been listening to Shannon O'Kelly talking with Christina Lee, physical therapist and pelvic health specialist from IRG Physical and Hand Therapy at Evergreen, talking about bladder health. And of course, you can get more information on Christina or any of the topics you hear right here on IRG PT Physical and Hand Therapy's Health Talk by going to their website, irgpt.com. That conversation continues right after this on Como.
It's a Northwest Lifestyle Weekend on Como News. Now back to IRG's Health Talk.
Our conversation with Christina Lee, physical therapist and pelvic health specialist from IRG Physical and Hand Therapy, continues with Shannon O'Kelly.
Christina Lee, physical therapist, pelvic health specialist. Thank you again for spending time with us and sharing what you do at work to treat patients with pelvic dysfunction. And we're talking about bladder and mostly bladder incontinence. And you were just saying that you really focus on these muscles inside, not the muscles on the outside. But we are on the radio, but help our listeners understand what these muscles on the inside do to help bladder function.
So your pelvic floor muscles on the inside of your body help you keep that urinary control. For example, when you cough or sneeze or laugh or maybe blow up a balloon, those are the times when it can put the most strain on our pelvic floor muscles. And so that's why sometimes you will hear about like, oh, I coughed, but oh gosh, I felt just a little bit of urinary loss. That would be an example of where strengthening your pelvic floor musculature would be so beneficial to help you keep that urinary control. The other type of common urinary loss would be, it's called urinary urge. And so the example would be, I could hold it for the last 2 hours, but I can't seem to hold it for the last 10 seconds. Pelvic floor muscle strengthening and a little bit of changing some of our habits can help us have that better urinary control and be able to cough and sneeze and laugh and be fine and stay dry.
Is there any statistics that you know of, population-wise, of how many people are going to experience urinary incontinence or urge control in their lifetime?
Women more than men. On average, I'm going to say around like at least 30% of women at some point in their lives will experience some urinary loss. Men tend to have that experience more often in regards to prostate enlargement.
Right. And so when this happens, I mean, basically what's going on here, as those muscles in the pelvic floor weaken or get tired or worn out, they don't control that bladder, but you can then strengthen those up by teaching exercises that are pretty easy exercises. That's easy for me to say, right? I'm not doing them, but they're fairly simple exercises, and your intervention can be very helpful.
Absolutely. And you can practice those exercises in a variety of positions, including, so it's usually a little easier when you are horizontal. Your muscles do not have to work against gravity. It's a little harder in a standing position or like a deep squat type of position. Those are also times, for example, when you're exercising, that you want to be able to have that support and control for your bladder.
Christina, again, thank you for your time. Great information. I'm sure a lot of our listeners out there want to get a hold of you, and they can get a hold of you at irgpt.com. That's irgpt.com.
Thank you, Shannon.
All right, that's been Christina Lee, physical therapist and pelvic health specialist from IRG Physical and Hand Therapy at Evergreen. Do you tend to see that the bladder health issues we just discussed, more of that coming on with age, or is this something you can see in younger people too?
Oh, it's predominantly as we age, and for female patients, it's after childbirth. But men can have bladder leakage and incontinence, but more prominent in the female population, the male population, and yes, with age.
Thank you again, Christina Lee. And coming up next, we're going to talk with Dr. T.R. Morris, thyroid and adrenal-related fatigue, as we continue after this time out on Como.